Okay, let's continue about metabolic disorders. Among the metabolic disorders, hypoglycemia is the most common metabolic disorders that affect the CNS. As all you know, brain is important organs that critically depend on the continuous supply of oxygen and glucose. Without glucose, the CNS cannot function normally and results in irreversible neurological damage and neurological cell death. So this can be seen in chronic liver failure, diabetes, and insulin-producing tumors. Normally, liver can produce glucose when the body needs. For example, like fasting. When we fast, the glucose can be provided from the liver continuously even though we don't eat any foods and drink that supply glucose. Okay, so the liver can synthesize glucose from the glycogen storage when the body needs. Diabetes, okay, as a complication of treatment of diabetes from insulins and oral hypoglycemic agents, as a complication and side effect of the drug, the patient can have hypoglycemia. And insulin producing tumor, you know the insulin is the glucose lowering hormones. So when there is excessive production of insulin from the tumors, then the patient can present with hypoglycemia. Another metabolic disorders that affect the CNS is lysosomal storage disease. Lysosomal storage disease is uncommon inherited disorders. It's characterized by a deficiency of various lysosomal enzymes. Without lysosomal enzymes, some of the macromolecules in the cells cannot be broken down. And lysosomal enzyme deficiency results in accumulations of these macromolecules in the cells and dysfunction the cellular normal. Another metabolic disorder is hepatic encephalopathy that's seen in acute liver failure and chronic liver failure, also known as cirrhosis. Hepatic encephalopathy is because of increased level of ammonia in the blood. So where this ammonia come from? Okay, so ammonia is the product from protein metabolism, and this ammonia byproduct of protein metabolism is potentially toxic and they can pass through the blood-brain barrier and can damage the brain cells. But in normal individual, if the liver is still normal, these ammonias are metabolized into urea and the urea is excreted in the kidney. But in case of acute liver failure and chronic liver failure, these ammonia cannot be metabolized into urea. So they can easily pass through the blood-brain barrier and interfere with the brain function, especially the neurotransmitter like gamma aminobutyric acids. In severe cases, the patient progresses to coma and results in permanent CNS damage. Another CNS disorder is tumors. Okay, so CNS tumor is the second most common tumor in children, but in adults it's not common as children's. And this brain tumor usually present clinically with non-specific symptoms of raised intracranial pressure like headache, vomiting, epilepsy, or localizing signs due to central nervous system invasions. CNS tumor have many types and it's classified and graded according to the cell of origin and its biological behavior. In case of children, most of the tumors are situated in the posterior fossa where there is a cerebellum and the hindbrain. In adults, 70% of cases are situated supratentorially, that means in cerebral hemisphere, and both intrinsic and extrinsic tumors occur frequently. Intrinsic tumors means primary brain tumor and extrinsic tumors means the tumors spread from the other organs carcinomas. This image shows supratentorial regions and infratentorial regions. Supratentorial region is mainly made out of cerebellum and infratentorial region is made out of cerebellum. So infratentorial regions and supratentorial region is separated by a tentorial cerebelli, which is the extension of dura mater of meninges. Okay, So this is important in case of CNS tumor. Brain tumor in the adult is occurred above the supratentorial, which is cerebellum, and brain tumor in children occur in infratentorial regions, which is mainly cerebellum. There are many types of CNS tumors, and their classification is based on the cells of origins. As you all know, in CNS we have glial cells, primitive neuroendodermal cells, aragonite cells that line the meninges, and nerve sheath cells that line the nerve, and lympho-reticular cells. Okay, so the CNS tumor is named according to their cells of origins. If the CNS tumor is originating from the astrocytes, we call it astrocytoma. If originating from oligodendrocytes, we call it oligodendroglioma. And if they are originating from the ependymal cells that line the ventricles, we call it a ependymoma or glioblastoma. The high-grade tumors that originating from the glial cells, we call this a glioblastoma. And in primitive neuroectodermal cells, we call it medulloblastom and neuroblastomas. Okay, so arachnoidal cells, they are aligned to meninges, so we call it a meningioma. In nerve sheath cell, we have two types. One is schwannoma, another one is neurofibroma. They both are originating from the nerve sheath cells, but depending on their morphology, we have two types. And lympho-reticular cells, if they are originating from the lymphoid cells, we call this a lymphoma. The image on the left is showing the adult brain tumor, which is occur in the cerebellum, the glioma. See, here is the brain tumor, glioma. Okay, so glioma, we call it glioma because it's originating from the glial cells. The image on the right is showing a meningioma. Here is the meningioma because it's originating from the meningothelial cells that line the meninges. As you can see here, this is the brain tissue. Okay, this is the covering of the brain, which is meninges, and there is a tumor that originating from the meninges, which is we call it meningioma. Another CNS disorders is degenerative disorders or neurodegenerative disease. These disorders are characterized by progressive loss of neuronal functions. The underlying pathogenesis process is, most of the cases, there is an accumulation of abnormal proteins aggregates because there is a mutation in altered proteins conformations or disruptions of the pathway involved in processing or clearance of these abnormal proteins. The most common neurodegenerative disorder is Alzheimer's disease. Alzheimer's disease is also the most common cause of dementia in older adults. Alzheimer's disease is a disease of old age and its incidence is increasing with the age. Clinically, the patient presents with insidious impairment of higher cognitive function like deficit in memory, visual spatial orientation, judgment, personality, and language. The pathogenesis is there is abnormal protein disposition like A-beta amyloid proteins and tau proteins. They are derived from abnormal cleavage of normal proteins that coded by the APP gene on the chromosome 21. Pathological features: overall brain is reduced in weight and there is a cortical atrophy. So the cortex of the cerebral hemispheres becomes reduced in size. And because of this cortical atrophy, there is compensatory dilatations of ventricular system, also known as secondary hydrocephalus. Microscopically, we can appreciate abnormal protein deposition as amyloid plaques and neurofibrillary tangles inside the neuronal cells. Okay, here the image on the left side is show brain specimen from Alzheimer's disease patient. As you can see here, the cortex of the cerebral hemisphere is reduced in size, and each individual gyri are also reduced in size. And because of the cortical atrophy, you can appreciate there is a widening area of the sulci, and the overall weight of the brain specimen is reduced in Alzheimer's disease. It's compared to the normal brain that shown in the image on the left. So this is the normal brain specimen. As you can compare here, the Alzheimer's disease, there is a atrophy of the cortex and widening of the sulci because of the cortical atrophy. These two pictures show microscopic features of Alzheimer's disease. The image on the left shows the position of amyloid plaques in the neuronal cells. Okay, and the image on the left shows neurofibrillary tangles, which is formed by accumulations of abnormal tau proteins, which you can appreciate here. The neurofibrillary tangles, it's indicated by the arrows. Okay, so these abnormal proteins cannot be appreciated in routine H&E stainings. To appreciate these abnormal protein deposition in the brain tissue, we have to do a specialized immunostains that use amyloid antibodies and tau protein antibodies. Another type of neurodegenerative disorder is frontotemporal lobar degeneration. It is also known as pig disease. Okay, as its name, frontotemporal lobar degenerations, the atrophy is mainly in the frontal and temporal lobes. As you compare to Alzheimer's disease, the cortical atrophy is the whole cerebral hemisphere, including other lobes of the brains. And clinically, the patients were present with behavior changes and language disturbance, and it's because of abnormal occlusions of TOS and TPD43 proteins. Another type of neurodegenerative disease is Huntington disease. Huntington disease is inherited disease. It is an autosomal dominant disease. Unlike other neurodegenerative diseases like Pick disease and Alzheimer's disease, Huntington disease is characterized mainly by progressive movement disorders, and they can also present as dementia as well. They are caused by degeneration of the strial neurons, especially the caudate nucleus and putamen, and it is due to excessive number of repeated CAG nucleotide sequences. Other type of neurodegenerative disease is spinocerebellar degenerations, where the degeneration involve the cerebellum and other components of nervous system, especially the spinal cord. As all you know, the cerebellum is the main organ that control the balance, equilibrium, and coordinations of the movement. Okay, if the cerebellum is degenerated, the patient will present with abnormal coordinations of movements and imbalance and unable to control their movements. So that kind of clinical presentation we call is ataxia. In spinocerebellar degeneration, we have several subtypes. One is spinocerebellar ataxia, which is inherited disease, inherited as a autosomal dominant disorders. Another one is Friedreich ataxia. Friedreich ataxia also inherited genetic disease. Okay, they are autosomal recessive disorders, and other type is ataxia telangiectasia. It is also an autosomal disease. The patients also have abnormal blood vessels dilatation called telangiectasia. To investigate the central nervous system disorders, we can do a variety of tests, like laboratory tests, lumbar puncture and CSF analysis, biopsies, and imaging technique. In laboratory tests, like metabolic disease, hypoglycemia, we can measure the glucose level in the patient blood. If the patient is suspected to have hepatic encephalopathy, we can measure the ammonia level. And also, alpha-fetoprotein level is increased in pregnant women with neurologic defect babies. Okay, so if the pregnant woman is carrying a baby with neurologic defect, the alpha-fetoprotein level in the pregnant woman will be increased. And lumbar puncture and CSF analysis is mainly done for infection of the CNS. Biopsy. Other CNS disorders like metabolic disorders, congenital disorders, traumatic disorders, biopsy is not recommended. Biopsy is only indicated for diagnosing the brain tumor. And lastly, in CNS, the imaging techniques are important. Okay, so imaging technique can detect the abnormality like congenital disorders, traumatic disorders, and neurodegenerative disorders. And also imaging technique can detect the abnormal tumor growth. In scar X-ray, we can easily appreciate the fracture of the skull bone. And if the patient is having epilepsy, we can do electroencephalography. In short, we call this EEG. And for the congenital disorders, traumatic disorders like hematoma and hemorrhage formations, we can do CT, MRI, and positron emission tomography. This image is MRI scan of normal brain and Alzheimer's disease. Okay, and the image on the left is showing a normal brain, and the image on the right is showing Alzheimer's disease. Okay, so in normal brain we have fully developed gyri and sulci, but in case of Alzheimer's disease, the cortex of the brain is atrophy, reduced in size, and there is a widening of sulci, also compensatory dilatations of the ventricles you can appreciate here. The overall, the size of the brain tissue is reduced in Alzheimer's disease. These two images show the PET scan of normal brain on the left and the Alzheimer's disease brain on the right. So the PET scan use radioactive material to visualize the activities and metabolisms of the brain tissues. So in the normal brains, the brain cells are functioning normally, so they uptake the radioactive substances and give a brighter color of the scan. In Alzheimer's disease, most of the neuronal cells are degenerative and inactive in metabolisms, so they won't take up radioactive materials. They less take up the radioactive material as shown in the image. Here is the two image of CT scan. Okay, on the left is the CT scan of skull bone fracture, and you can appreciate the fracture indicated by the red arrows. There is a two fracture line. Okay, in the CT scan, the skull bone is bright whitish in color because of the calcium components, and the icon, the diamond red icon, indicates there is a scalp hematoma. There is a swelling around the fracture lines because of there is a injury, so there is a soft tissue swelling like scalp hematoma and bruises. The image on the right is shown the CT scan image of epidural hematoma. In CT scans, the epidural hematoma is whitish in color and they are usually convex in shape. Okay, so this is the epidural hematoma. The hematoma occur in the outermost layer of the meninges between the skull bones and the brain parenchyma. Not only skull bone fracture and hematoma, CT scan and MRI can detect the infection like cerebral abscess that's shown in the left image, and also the MRI can detect the brain tumor. Okay, so the MRI is the best method to diagnosing and detecting the brain tumor. Here in this image, there is an abnormal tumor which is called a glioblastoma is can detect by the MRI scan.